Hi everyone, it's Alexa here with KelownaNow, and I'm excited. I'm sitting down with Dr. Michael Webster, and he is the dentist at Kelowna Dental Centre. And let's just start off easy. Can you give a little high elevator pitch of who you are?
Sure, absolutely. So, yeah, I'm the owner of Kelowna Dental Centre. We have about 5 other docs that work for us. A big practice. I was born and raised in Kelowna, and I'm a proud graduate of Rutland Senior Secondary. Woo! Go Voodoos.
Go Voodoos. Amazing. So I know that we're going to talk about something specific today, but can you tell people that maybe what makes you stand out from other dentists?
Yeah, absolutely. We are a full service dental clinic that offers every single aspect of dentistry. We are really focused on customer service. We know that dentistry is not the most inviting place to go, and people would rather be doing something else. So we fully understand that it's just as much about the experience as it is about the treatment the patients are receiving.
So trying to make people not afraid of you.
100%. 100%.
I definitely have that dental anxiety.
Yeah, it's very common. I think the literature says up to 50% of people have some degree of dental anxiety.
Yeah.
So we really cater to that, and to top it off, we are a full IV sedation clinic. We put people to sleep for the vast majority of treatments if they want.
Wow, I didn't know that. So me struggling with something like that, I have to really work myself up to go to the dentist. I could come by.
100%. This is precisely, this is the vast majority of why we do IV sedation.
Yeah.
Is a lot of people are so fearful they've avoided appointments.
Yeah, now, and have issues later or pain.
Absolutely. So not only do we have the solutions for it, like IV sedation, our team is designed to treat with individuals such as yourself. They're very caring and empathetic.
Amazing. So maybe anyone with dental anxiety, what do you recommend? You come visit and you talk through it first
100%.
and come up with a plan?
Yeah, take that first step. Give us a shout. My team is great on the phone. Right away, you'll be reassured with picking up the phone. And then the first step is just getting in the door. And we typically see people just relax immediately once they're dealing with the team.
Amazing. Why do you think that people are so afraid of that?
It's a very personable space, the mouth.
Yeah, I guess
so that's one thing.
Yeah.
And then, it's almost always associated with a procedure. Yeah. And as simple as you're likely going to get a needle at some point, and then the hairs on your arms start going up, and there's a bit of a loss of control as well while you're in the chair.
Well, and I guess sometimes certain things come up and you don't expect it.
Yeah, we kind of say it can be like going to the mechanic. Yeah. There's an unknown element there, and then unfortunately we can be delivered what we presume is bad news. You have to get work done, and there's associated costs with that. So it's kind of, you got to go through a rough patch to get to the good spot.
Yeah. Okay, awesome. Well, you guys do something really cool. Teeth in a day.
Yeah, that's my passion. That's my role in the practice. I am a general dentist that has expertise in teeth in a day, and I have a team surrounding me that just delivers this treatment that we call teeth in a day.
So walk me through it. What does teeth in a day? Could I get brand new teeth in a day?
Well, you could. However, your teeth look excellent, and you're probably not the candidate for teeth in a day. So we primarily see two types of individuals. One would be long-term denture wearers. Okay. They're unhappy with their dentures. They're loose. They're floppy. They have no confidence with them. They don't like to eat in public. Yep. And then also individuals who have extensive gum disease or cavities, bacteria in their mouth, loose teeth, wiggly teeth, and lack confidence with them as well. So these individuals we call having terminal dentition. So both these candidates need a new set of teeth that are anchored permanently. Okay. And we do this by providing dental implants. And with technology and our training and expertise, we are able to do this in one single appointment. It's pretty remarkable.
And when did this start? Have you been doing this for a while?
So this took me, I've restricted my practice to doing this about a year ago. I was doing a similar version of it prior.
Okay.
Teeth in a day has been around for some time. It's very prevalent in the U.S., less prevalent here in Canada.
We're always behind.
Yeah, unfortunately. So, but we're one of the only teams around that I'm aware of, even in Canada. There could be others, but we're one of the only teams that specifically only provides teeth in a day. I do not do anything else other than that.
Wow, amazing. So is this something that, like, let's say, you know, lots of people have veneers. Is this similar, or would you recommend this?
It's
over
different.
veneers?
So veneers is commonly a cosmetic procedure. So the teeth are still healthy enough to maintain and keep. Okay. However, from an aesthetic standpoint, when we're done with these patients and they receive teeth in a day, they look like veneers. The result is stunning. It's not only functional, they can chew food again. Their teeth do not come in and out. It's not a removable prosthesis like a denture. They're fixed in place, and people cannot tell that they're not permanent, natural teeth.
Wow, amazing.
Yes.
Teeth in a day.
Yeah, technology is incredible these days.
So would you say this service is for like a certain age group? Or are you seeing people younger doing these?
Yeah, that's a great question. I just finished 2 cases this week that the 2 individuals were in their 30s.
Oh, wow.
Okay, so there's numerous reasons that can contribute to this. Dental disease is multifactorial. One individual I saw this week had gone through 3 to 4 pregnancies. I don't remember exactly. But during that time period, you can be very susceptible to gum disease and tooth decay. And
women don't go through enough.
Yes, I know, exactly. So they can be susceptible to those factors, and it takes a beating on them. So this individual had extensive tooth decay, lost teeth because of it. So we just completed teeth in a day for them, and honestly, we passed them the mirror at the end of the procedure, and it was just a waterfall. Yeah, it was tears of joy. It was incredible.
Well, there's something about it, you know, I'm not single, you're not single, but like when you're going out on your first date or something, a lot of people look at your teeth.
Yes. It is one of the most recognized thing. There's tons and tons of polls about the relationship between teeth and confidence, teeth and success, teeth and happiness, smiling. The psychological component of a healthy mouth is massive and often underrated.
Yes.
Yes.
Because it actually affects lots of other
things. And it's funny, I talk about this with my team, but everyone comes in. The men are hilarious, saying they just want function, but they ultimately want to look good as well, and there's nothing wrong with that.
Yes. What about, is this like a service that, let's say you know how some people grind their teeth a lot and it just seems like their teeth are getting smaller and smaller?
100%.
Not thinking of one particular.
See, you're practically a dentist, but we call that bruxism. Okay. And this is a massive contributing factor to people that end up with teeth in a day. So it can grind down the teeth. If it's left untreated or managed, it can grind down the teeth, making them more susceptible to cavities and breaking. And a vast majority of our teeth in a day patients are grinders.
Yeah, because I was thinking about it. If you grind your teeth enough, and your teeth get smaller.
Absolutely. There's nothing better than prevention. So if you're a grinder, wear your night guard.
Yeah.
At a young age.
Yeah.
And forever.
Nice. I kind of think I'm a mouth breather, which is not great.
Yes, and that happens too. But just even mouth breathers can go, as they go through their sleep cycles, they can experience a certain degree of grinding.
Okay.
Yeah.
Amazing. All right. Is there anything else you would like to talk or tell Kelowna?
You know, basically, it's just take that first step, pick up the phone, call us. There's a ton, like we talked about, there's a ton of anxiety about this. There's a lot of unknowns. We're here to help. We've got a fantastic team, and taking that first step, you know, the only regret our teeth in the day patients say is that they didn't do it sooner. Yeah.
Like they were living in this like
100%.
Embarrassment.
100%.
You get confidence and changes everything.
Exactly. It's often life-changing for these individuals.
Well, it sounds like you have a big team, so you're constantly taking new patients, not just for teeth in a day. So don't forget, if you're needing a new dentist and you have anxiety, you guys sound like the good place to come.
Absolutely. Thank you.
Well, awesome. Thank you for tuning in to Kelowna Now.